In the dispensing process, hyaluronic acid and other products need to be prepared to mix the medicine. After expelling the air, slowly draw out it with the syringe. Push the syringe 20 to 30 times to allow the medicine to mix thoroughly. The syringe should be advanced slowly to allow the 2-3 liquids to fully blend. Install dermapen and check if it can operate normally. To clean the face, you can choose to apply anesthetic cream or anesthetic mask and wipe it clean with saline after 30 minutes. First, use iodophor to disinfect the skin, and then wipe the skin with saline. Use saline to wipe clean the iodophor. Apply the medication to the skin surface and use dermapen for treatment. Start testing from level 1 first, and gradually increase the frequency. Adjust the needle length to 0.5 mm and treat on the forehead. Adjust the needle length to 1 mm for cheek treatment. Adjust the needle length to 0.25 mm to treat sensitive areas such as the chin, mandible, nose, lips, etc. After treatment, apply a facial mask for repair.